fine. Yeah, that is a consultation. Very good. Next one. Is he talking to another medical professional, or is he talking to a patient or carer? Is he talking to a medical professional or a non-medical member? Is he talking to a medical professional or a patient or carer? You have to say. Is he talking to patient? A patient, you have to say a patient. One means a patient. Always remember that. Okay, a non-medical professional, a carer. Yeah, you're right. So that is the next question. Yes. You're absolutely right. Yeah. So now the next point is, is he talking to the patient or a carer? Is he talking to a patient or is he talking to a carer? Come on, write down. A patient or a carer. Remember, whenever you are writing a word, you have to be very careful. You have to be singular or plural. A patient or a carer. Okay, fine. Right. So now next question. How old is, okay, what is the gender of the patient? What is the gender of the patient? What is the gender of the patient? Come on. Okay. Patient. Okay. Gender. How do you know that he is male? What word is telling you that he is male? Okay. Two words are giving the indication that he is a male person. What are the two words? Word number one, word number two. Two words I need. Two words are helping you that he is a male person. Come on, all of you participate actively. Otherwise, go and sleep. Or do whatever you want. If you're participating on the platform, I want your attendance. I want you to get A grade. I don't want any sleeping people here. Yeah. One word is boy. A boy. Not boy. A boy. A 9-year-old boy. So a boy. So that is number one. The next word is Tony. Come on, write down. A boy, number one. Tony, number two. So these two words are telling you that he is a boy. Okay, how old is this boy? How old is this boy? Come on, all of you, write all the answers. Don't bother. Others written or not, that is not. Others will get pass mark. You will not get pass mark. That is not the point, right? How old is the boy? Or how old is Tony? Or how old is the boy? So you are trying to analyze the background of the story, what you will listen there. Okay. So what type of words, who is going to speak? Now, neurologist is a male or a female? You have to think now. That level of depth you have to go. Now, okay, patient is not there, but patient's relative is there. Is he a carer or a family member? Come on, write down. Is he a carer or a family member? Is he a carer or a family member? So for this person, is he a carer or a family member? Okay. Now, what is the gender of this person? What is the gender of this person? What is the gender of this person? Come on. Write down. Participate actively, please. Active participation. You want to get A grade? Participate. Okay. He is a male person. Okay. How do you know what word is indicating that he is a male person? What word is indicating that he is a male person? Yeah. What word is indicating that he is a male person? Yeah. Yes. what word is indicating that he is a male person? Father. Yes. So father. And now, what is the case? What is the case? What is the case? Means what is the problem? What is the medical condition of the patient? So be careful. Nobody should write capital letters. Nobody should write capital letters unless and until it is a must. Everyone is writing capital letters. I don't know why. So nobody should write a capital letter. Yeah. Right. Seizures. Okay. Right. So this is one particular task. Okay. Now we are going to our required task. Our required task. This is Tony Fitzgerald. So till now we have seen, okay, Tony Fitzgerald. Now we'll go to, okay, the next one, which is important for us, that is Dominic Sousa. I just gave you an idea, okay, before, okay. First, let us finish our first part, then we'll go to the second part, okay. Now, I'll give you, so by mistake, I have taken the second extract. I should have to take extract 1, but by mistake, I took extract 2. Okay, no problem. Yeah. So this girl is here. What is this girl's name? Sakshi. Sakshi, are you there? Sakshi. Sakshi. Okay. She did not join. Okay, no problem. Yeah. So, right. So now we are going to do both the sessions actually. Hide floating meeting. Yeah. Again, this second has some. So let us see. This is Dominic Sousa. So we can take presenting symptoms till here 1. And then we can take a history of the conditions. Okay. History of the conditions. And then, uh, and then, yeah. Yes, this is the first part. Okay. So let us take this is the first part. I'm sorry, actually the screen went off to the next page. So that's why I had to go to the, and I did not notice that. Yeah. This is extract 1. Anyhow, no problem. That also we are going to do na? From clipboard. Yeah. This is 1. Yeah. Yeah. Function printed screen. Full screen. Yeah, this is second page. And this is the third page. Yeah. I'm sorry for that. I did not notice. Anyhow, we are going to do this one also. Okay, because of my mistake, we are going to learn one more thing. What's the problem? Yeah. So this is number 1. And this is number 2. This is a Tony Fitzgerald, right? Tony Dominic Sousa. This one is Dominic Sousa. This one is Dominic Sousa. But this is, what is this? This is extract 2. Extract. Did I do here? So this is one is Dominic de Sousa. Yeah, this is one is Dominic de Sousa. Yeah. So that is one is Dominic de Sousa, and this is extract 2. Yeah. So one Dominic de Sousa. Then next one is has one glasses. Has one glasses. Yeah, this is right. Then I have taken correctly. And the next one is left eye. Left eye, correct only. Then next and third one. Only the second page I have to put wrongly. So Tony Fitzgerald. Yeah. Then seizures. Tony Fitzgerald. So this those were correct only. Okay. This we'll see later. Okay. So second, yeah, this one. Okay. Only first page I took wrong. Otherwise everything was correct. Yeah. So this also we'll do after that one. So no need to worry. I'm going to teach you the secrets. So this is 22 to 24. Oh, 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 oh. Okay. They'll manage. So full screen. This is change screen. Okay. Performing well academically. So here one more little up will take academically. So here, academically. Yeah, till here. Yeah, right. I think this is fine. Social history can't come in the previous page. Yes. So we are going to do 2 sessions instead of 1 because 1 page I mistakenly took. So that is the punishment for me. I'm going to take 2 sessions, right? Yeah. Yes. Now get ready. 19 members are there. 19 members are there. Yeah, good. Okay. Get ready. I'm going to dynamic practice. How many are you are ready for dynamic practice? How many of you want to get a 24 out of 24? Because afterwards I'll play. But before we'll try to analyze the questions here. 24 out of 24. Are you in? Say yes. Are you out? Say no. And those who say no, you can leave. Those who can say yes can be there because you are going to practice definitely. Okay. You have to practice for every question. Whatever I tell you, you have to give as many answers as possible. That's the yes meaning of S. That's the meaning of yes. Yeah. So, Farzana Mursi TJ. Who is TJ? Can you write your full name, please? Mageshwari, Grishma, Shamili, Jayapriya. Yeah. Pranita, Arman. Very good. I can understand how the people are ready to. Geneva, very good. Geneva, Anto, Manjula, Hemanti, very good. Come on, come on. Yeah. Yes. Yeah. Yes, please. Yeah. So TJ. Who is TJ? Can you write your full name, TJ? Right. Okay. So you are ready. So get ready. Hide floating meeting controls. Yeah. Now here we have already seen the second part. Now we'll see the first part. Now, who is the medical professional here? Who is the authority here? Write down your answers, please. Write down your answers, please. Who is the authority? Extract one. This is Dominic de Sousa. Extract one. Extract one. Okay. Who is the authority here? Who is the boss here? Who is the boss? Who is the main person in this extract? Okay. Yes. Now, Dominic de Sousa is the name of the patient. Okay. So, ophthalmologist is talking to another medical professional, or is he talking to a patient, or is he talking to the carer? Who is the receiver in this discussion? Who is the receiver in the discussion? Okay. Yeah, he is a patient, not a carer, not a medical professional. Very good. A carer, a patient, a medical professional. What is your answer? You said patient. Very good. That's right. What is the name of this person? What is the name of the patient? What is the name of the patient? What is the name of the patient? Write in capital letters. Don't write short letters, capital letters. Don't write half. Dominic is not correct. Dominic de Sousa is correct. Full name. Okay. Yeah. Dominic de Sousa. Okay. Is this a normal discussion or is it a consultation? Is this a normal discussion or is this a consultation? Is this a normal discussion or is this a consultation? Is this a normal discussion or is this a consultation? Come on. Yeah. Right. Next one. Now let us see. It cannot be a normal discussion because here you see the patient is there. So it's an official consultation, medical consultation, because the word patient is there. That's the point. Okay. So it is a consultation. Now, Dominic de Sousa, patient. Okay. Do you think he's a male person or a female person? There is a reason behind this. Do you think Dominic de Sousa, you have to guess whether he's a male or a female? Come on. What do you think, Dominic de Sousa? Is it a male or a female? What do you think? Dominic. Mostly you can assess whether it's a name male or female. Mostly you can assess. Okay. If the patient is a female, the ophthalmologist will be male or female. So now you can see patient. Okay. patient. If patient is male, then ophthalmologist is equal to female. Remember that. Yeah. And if patient is female, ophthalmologist will be male, because that is gender clarity. It will be there for you, so that you will not get confused. So how many questions are there in this part? How many questions are there in this part? In this extract 1. Extract 1. How many questions will be there in extract 1? Extract 1. How many questions will be there? How many questions will be there in extract 1? Yeah, 12 questions. Okay. Now, these extract 1, 12 questions will be in how many different types actually? How many types do you know? 1 type or 2 types or 3 types or 4 types? Can you tell me? Can you tell me how many different types will be there in the questions? All of you, come on, participate. Because you should be mentally ready. In these 12 questions will be 1 type or 2 types or 3 types. Okay, right. Now let us see. You now have 30 seconds to look at the notes. 30 seconds. 30 seconds. Do you know what is this time called as? 30 seconds before the audio. Before the audio. So, before, there are 3 phases. One is before, and the second one is during, and third one is after. So, after the audio. So you should know before audio, during the audio, and after the audio. There will be 3 parts. 3 parts of time. What is this 30 seconds time called as? Can you tell me? What is this 30 seconds time called as? Okay. Actually, there are 3 stages in listening. Can you tell me what are these 3 stages? 3 stages in listening. There are 3 stages in listening. What are these 3 stages in listening? Can you tell me? The first one is called pre-listening stage. Make notes, all of you. Pre-listening stage. The first one is called pre-listening stage. And the second one is called while listening stage. The second one is called while listening stage. And the third one is called post-listening. Don't think you are wasting your time, because you are learning many important things which nobody else will tell you. Post-listening stage. So pre-listening stage, while listening stage, and 3 is post-listening stage. Do you know what you will do in pre-listening stage? Do you know what you will do in pre-listening stage? Do you know what you do in pre-listening stage? Pre-listening stage, you will do, number 1, pre-listening stage. Pre-listening stage. What you will do? So you have 30 seconds. Pre-listening stage. In pre-listening stage, okay, pre-listening stage, you have 30 seconds. 30 seconds. Now, how many questions do you have? 12 questions. 12 questions. Means each question, how many seconds? Can you tell me? Each question, how many seconds? How many seconds you have to spend for each question? So 30 divided by 30 divided by how many? 12. So is equal to how many seconds? 2.5 seconds. Very good. So each question you have to see for 2.5 seconds. This is called planning, 2.5. Okay, 2.5 seconds. So that means you have 2.5 seconds for each question. 2.5 seconds for each question. In these 2.5 seconds, what you have to do, you have to spend for one question time, one question, you have to spend 2.5 seconds. Okay. Now, what are you going to do here? What are you going to do in this 2.5 seconds? What are you going to do here exactly? Can you tell me? Can you tell me? Can you tell me the exact word that you are going to use here? Okay. Yes, I'm going to tell you. Brainstorming. Brainstorming. You're doing something called brainstorming. Brainstorming means guessing the possible answers. Guessing the possible answers. You're guessing the possible answers. Brainstorming means you're guessing the possible answers. How can you guess the possible answers? How can you guess the possible answers? You can guess the possible answers based on the clues. So read the clues. Identify the clues. Identify the clues. Identify the clues. Then they will tell you what you can expect. If you identify the clues, you can guess the words. Now the clues will be in the same blank. So for the clues, you have to check number one, number A, before the blank, and B, after the blank. You have to see before the blank, you have to see after the blank. The words before and the words after will tell you exactly what words might come. Not will come, what words might come. Okay. So you can guess that one. I am going to show you how you can guess the words. I will going to show you how you will guess the words here. Right. Now you have to brainstorm another way for three different things. First one is, these are the three parts of speech. Parts of speech you have to focus. You have to focus on three parts of speech. What are these three parts of speech? Number one, nouns. The nouns in that particular line. Number two, adjectives in that particular line. And number three, the verbs in that particular line. So the nouns, the verbs, and the adjectives. You have to focus on these three things. You have to focus on these three things. Then it will be easy for you. Then it will be easy for you. Now let us see. We are going to focus on these things now. Yeah. So Dominic de Sousa. Yes. This is the, yeah. Now, you see there, Dominic de Sousa. Yeah. So Dominic de Sousa, yeah, has worn glasses for 5 years and left eye. Okay, fine. Yeah. Now let us log this one. Let us log this one. Right. Yeah. Now you can see there. Question number 1. Question number 1. Fireball. Yeah. Firecracker. Because they will be blasted one after another immediately. Firecracker 01. Yeah. Now here, be ready to answer my question. Then only you can get an idea here. Has worn glasses for 5 years. So it's age-related myopia. So symptoms first apparent in poor dash. Poor is an adjective. So the next one will be a noun. After adjective, symptoms first apparent in poor dash. Okay. Now this is an adjective. This is an adjective. Yeah. Poor is an adjective. So after an adjective, what will come? After an adjective, there should be adjective and then noun. Clever boy, poor light. Okay. So like that. What exactly you will get here? So symptoms first apparent in poor dash. So what will you come here? What will you get? Adjective or a noun or verb? Adjective is already here. Remember that. So what you will get here? Number noun, you will get a noun. You will get a noun here. You will get a noun. Okay, fine. Now give me the related words which you can fit here. Symptoms first apparent in poor what? Guess what words may be there. Guess the words, please. Guess the words. Poor light. Geneva, you are not supposed to write capital letter Geneva in the middle of a sentence. Remember that one. Geneva, you are a new student. So don't get upset if I am correcting you. Okay? Don't get upset if I am correcting you. Yeah. So tell me, okay, sir. Tell me, okay, sir. Yogendra Dalvi, you are giving me a direct message. Don't give direct message, please. Again. I don't want anybody to give me a direct message. Because every time you give a direct message, I have to change there. Yeah. So, Geneva, yeah, okay, sir. Thank you very much. Now, rewrite the answer with a small letter. That is very important. Otherwise, you'll forget. And again, you'll do the same mistake. So, it should be small letter. So, rewrite the word with a small letter. Poor light, poor vision, poor quality, poor surroundings, poor environment, whatever you want. Poor symptoms. Yeah, come on, write down. Symptoms already there. Okay, symptoms already there. Who is that? Mageshwari. You cannot write symptoms because symptoms already there. Symptoms apparent in poor symptoms is not fine, right? Yeah, Geneva, thank you for being obedient. Yes. Poor environment, poor surroundings, poor ambience, poor light, poor vision, poor situations, poor conditions, anything, whatever you feel, you can write there. Yeah. So next, number 2. Number 2. So Firecracker 2. Firecracker 2. Okay. So now here, Janapriya, Jayapriya, you have written vision, capital letter, light, L capital letter. I'm sorry. Rewrite with a small letter because in the middle of the sentence, you are not supposed to write S capital letter. No need to say sorry because you did not do anything wantedly. Unintentionally, you have done. So if you do unintentionally, no problem. You are a student. You are supposed to do mistakes. So I am supposed to do correct you. No need to say sorry. Okay, that's not a problem. But next time, be very careful and there will not be any need to say sorry. Yeah. So, Firecracker number 2. Yes. Rapid left eye affected. So you relax. rapid deterioration in vision. Relax. Now then immediately the blank is here. So be ready for here. Now next one. Here you have the word before. It is a. A. A is an article. A is an article. After the article, what will come? Noun or adjective or verb? Okay, what will come? Noun, adjective or verb? What will come? A book, a pen, a table. Okay, it will come. There may be two words also. A tall boy, adjective and noun. So there are two combinations here. You can get a noun or you can get an adjective and a noun. For example, stopped working as a doctor, government doctor, as a general physician. So like that, an adjective may come and also a noun may come. An adjective and a noun may come. So come on. Yes, please. A driver, a teacher, a typist. Come on, write down your answers. Write down all your options. Brainstorming. Brainstorming. I want activity. A teacher. Yes, you are right. You can write a teacher. Any mistakes are there? I'll tell you. A typist, a teacher, a preschool teacher. Very good. A preschool teacher. Come on. A preschool teacher. Yeah. Come on. Write down. A carpenter, a plumber, a driver, a typist, a manager. Come on. Think about all the other activities, names. A salesman, a computer operator, a consultant, a salesman, a businessman. Come on, write down. If you can't write, at least copy my words and write. Nah? Think about your own words. Yeah, if you can brainstorm like this, then only in the exam you can do it fast. Now you are dull here like a snake which has eaten mud. Then how will you do in the exam? A is already there, Manjula. So Manjula Hemanti, don't you know that A is already there? So your answer is wrong. Write again without A. A is already there. A is already there. Priscilla, there are two mistakes for you. Priscilla, you cannot write a capital letter O in the middle of a sentence. Then there is a word called A. A organizer is wrong. An organizer. A is already there. So how can you write organizer? An organizer. So your answer is wrong itself. And then you should not write a capital letter also. Yeah, Manjula, very good. A chef, a manager, a plumber. Come on, think about more answers, more answers. A teacher, a headmaster, a banker, a computer operator, a coordinator, a leader, a team leader, a supervisor, a branch manager, a taxi driver. Very good. Come on, write down. Write down. Brainstorming. Who is bothered about the answers? Who is bothered about the answers? I want you to brainstorm. I want you to brainstorm. Come on, think about more options. Think about more options. You want 24 out of 24? Think. Thinking only is the helper. Thinking only. A bank manager, very good. A lab technician. A lab technician. Yes. Fine. Good. Police officer, Arman Kanani. You lost the mark because there should not be a capital P. Write again with a small p, please. Yeah, very good. Now let us go to Firecracker C. Firecracker 3. Firecracker 3. Firecracker 3. Yeah. So, what do you think? Possible dash. Possible dash. Observed in left eye. Possible. Possible. Possible difficulty. Noun will come there. Noun will come there. So write down what are the examples. Come on. Tint to very good. Dryness, redness, blurred vision. Very good. Come on. Come on. Come on. Write down what glaucoma or any word. Any word. Blurred vision, redness. Okay. Blurred vision, infection, Yeah, possible infection. Come on, come on, come on. What else? Words may be there? You can write swelling. May Mursi. Doctor May Mursi. Doctor May Mursi. Don't you know that yes should not be capital letter? Rewrite with a small letter, Dr. Mursi. Please rewrite with a small letter. Okay. And next time, whenever you are writing, check before submitting. Blindness. Very good. Yeah, come on. May Mursi, I'm waiting for your correction. Yes, that's very good. You are very excellent. You are very obedient. Tears, very good. Shamili, tears, very good. Come on. Possible sight. Sight. Short sightedness. Sight is there normal, ne? Possible sight, short-sightedness, long-sightedness, or something like that, maybe. Cataract, very good. Redness, very good. Yeah. So that is the third question. So firecracker 3. Now we are going to firecracker 4. Myopia, very good. Next one is firecracker. Those who are actively participating only will get marks, okay? 24 out of 24. Others, don't please trouble yourself to write, and you will exam will trouble you later. Firecracker O4. Firecracker O4. Increase intake of preposition is there, of something, of something. Increased intake of milk, increased intake of alcohol, increased intake of drugs, increased intake of water, increased intake of food, increased intake of fluids. Yeah, noun will come here. Noun will come here. Come on, write down. Write down. Write down. Come on. Yeah, water, vitamin A, gluten, vitamin rich diet. Vitamin rich. Hyphen should be there. Prasanna Ankam. Vitamin hyphen rich. Vitamin hyphen rich. Hyphen is important. Priscilla. You have used a capital letter. You are not supposed to use a capital letter in the middle of the sentence. So rewrite with a small letter, please. I'm waiting for your correction. Then Yogendra. Yeah. Water. Vitamin rich. Yeah, Prasannankam, you have written correctly, but after hyphen, there should not be a space. Without a space. Without a space. Priscilla, what is the spelling of vegetables? Earlier you wrote correctly, but now you wrote a wrong spelling. Why? Okay. Earlier spelling was right, or now spelling? Earlier you wrote correctly. Now again you are doing mistake. Then you said no capital, then you are doing a spelling mistake. How can you do that? Yeah, Prasannankam, you are right now. Vitamin rich should be written like this. Okay, low salt, vitamin rich. Okay, diet, low salt diet, low fiber diet. Okay, protein protein rich diet, like that one. Pranita, space no need before hyphen. Okay, rewrite with correction. Vitamin rich, you have written correctly, but before hyphen there is a space. No need a space there. Priscilla, rewrite correctly. Yeah, you have written correctly. Thank you for that. Okay, thank you for that. You want 24 out of 24? Be patient enough. Be patient enough if you want 24 out of 24. Yeah, Pranita, rewrite. Yeah, very good. That's absolutely right. You're awesome. Next one, Firecracker 5. Yeah, firecracker 05. Yeah, dash suspected. Dash suspected. What is suspected? Something is suspected. Something suspected. That is cause of something. What is that thing? What is that thing? Maybe glaucoma. Maybe what is that? Cataract. Okay, vitamin deficiency. Yeah, injury. Geneva. Injury. How can you put a capital letter? This is a bullet point. You may say this is the beginning of the sentence. Okay, May Mursi, you may say it is the beginning of the sentence. But see, in the beginning of the sentence, anywhere capital letter is there? Is there anywhere capital letter? Then how can you write a capital letter? Is there anywhere capital letter? In the bullet points, these are called bullet points. You're not supposed to put a capital letter for this unless and until it is compulsory. Otherwise, don't put a capital letter. No need to say sorry, Geneva. I told you no need to say sorry. You are just a student. You are prone to do mistakes, and it is my duty to correct you. Okay? Don't get hurt. If I tell you this is wrong, don't get hurt. New students, especially, don't get new students. Jay Priya, then what is that? Geneva, what's that? Mageshan. Okay? Sorry if I name you wrong names. Don't forgive me because pardon me, because I can't remember every name. Suddenly it comes. Okay, it takes time for me to. Okay, right. So write small letters. Write small letters. You are not supposed to put capital letters. You are not supposed to put capital letters in the middle, in the bullet points. Remember that. Yeah. Myopia, cataract, infection, glaucoma. Very good. Very good. Very good. Astigmatism. Very good. Lot of words are coming. Okay, lot of words are coming. All these words, write down and keep them, because these are the guest words. These will definitely come in the exams. If you write like these words and keep them, and all these words, write and keep them in a notes and just send me. I'll post in the group. It will be useful for everyone. Yeah. Next, diabetic retinopathy, astigmatism. Very good. Prasanna Ankam. Good. Yeah. Arman, Jaypriya. Yeah. Very good. All of you. Very good. Now, next. So, next we are going to the next page. That is question number 6. Yeah. Question number 6. Okay. Firecracker. Fireball is in reading. Firecrackers, because they come one after another immediately. So, sixth one. Firecracker 6. Yeah. Problems judging something of objects. Something of something. Pen of Peter. Car of Abraham. Uh, house of Martha. So dash of dash. So of preposition. Before and after there will be nouns. So problems judging color of objects. Yeah, correct. Distance of objects. Correct. Yeah. Come on, come on, come on. Shape maybe, distance maybe, color maybe, size maybe. Come on, come on, come on. Write down. Think. Size, shape, color, type. Yeah. Come on. Write down. Problem judging size of objects, distance of objects, shape of objects, type of objects. Okay. And what do you call it? Surface. Yeah. So whatever it is. Okay. Texture, maybe rough or soft or okay. Yeah. Color, texture, surface, shape, size, color, type, distance. Okay. Right. Very good. Now, so this is how you have to judge. If you do 10 tests like this, the other length, yeah, very good. Length, breadth, yeah, height, length, breadth, height. Yes, correct. Very good. Yeah. Next one. Write down. If you have not written it there, you can write my words also along with that one. The next one is a firecracker 08. Sorry, 7. Firecracker 07. Now, central vision is a dash. Central vision is dash. Perfect, imperfect, okay, affected. Very good. It may be perfect. Jaya Priya, why are you writing capital letter? Do you think that I will miss anything? No way. Kadiresan, I think you are a new student, right? Are you a new student, Jaya Priya? Kadiresan, I'm not very sure. Yeah, you registered yesterday. Yeah, yeah, yeah. I'm sorry. I cannot. I'm an old man. I cannot recall many things suddenly. Yeah. So that name was different. This name was different. Yes. Central vision is affected. Central vision is blurry. Central vision is decreased. Central vision is increased. Central vision is average. Central vision is perfect. Central vision is okay. Central vision is deteriorated. Central vision is declined. Central vision is diminished. Central vision is poor. Central vision is average. Central vision is below average. Central vision is above average. Central vision is something, whatever you want to do. Okay, right? That's it. Next one, firecracker 08. Yeah, dash vision unaffected. Central vision already discussed. Yeah, central vision is over there. Now, what are the other visions? Top vision, lower vision, peripheral vision. Okay. Think about near vision. Far vision, whatever you want to write, you write. No problem. Nobody is bothered. Nobody is bothered. Write whatever you're only guessing, right? You're only guessing, right? Many students are getting 450, 460. That means they're getting 24 out of 20 in part A. Guessing is not a problem. If you guess only, then you are doing that one, it will be easy for you, no? Yeah. Then next, long vision, short vision, okay, peripheral vision, okay. Then next one, Firecracker 09. Firecracker 09. Yeah, Firecracker 09. Yeah. Has stopped dash. Has stopped dash. General vision. Has stopped dash. Has stopped doing something. Has stopped writing. Ink form will come maybe. Had stopped reading. Had stopped studying. Had stopped watching movies. Had stopped watching news. Has stopped driving. Has stopped using spectacles. Has stopped reading glasses, using glasses. Has stopped using computer. Has stopped medications. Has stopped drugs. Has stopped eye drops. Has stopped ointments. Has stopped night driving. Very good. Has stopped alcohol. No. Has stopped alcohol. No. Has stopped drinking alcohol, consuming alcohol. Okay. Ing form must be there. Has stopped taking medications. Ing form must be there. Ing form must be there. Has stopped taking medications. Has stopped consuming alcohol. May Mursi, you made a mistake. I don't want to tell the mistake again. I already told you once. You're doing the same mistake again. Rectify your mistake. Very good. You're a darling, okay? Very good. This is a doctor. Okay, see how she's obedient. Like that, everyone should be obedient. Yeah. Then next one. Has stopped consuming alcohol. Has stopped smoking. Ing form is a must here. Remember that one. Ing form has stopped doing something. That's it. Okay. The next one. Uh, very good. Next one is a firecracker 10. Yeah. Asked for clarification regarding dash. Has stopped for. Has stopped. Asked for clarification regarding. Asked for clarification regarding dash to be administered. Okay, clarification regarding medications, drugs, ointments, eye drops, creams, surgery. Okay, recovery, anything. So think about all the options. You can think whatever you want. No problem at all. Thinking is not a problem. Okay. When you are brainstorming, you'll be ready for the exam. Nah? Yeah. I'm going to play after this one. Nah? You have to get 12 out of 12. Yeah. Next one. Yeah. Injection. Zoya. Injection. 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 Injection is something different. Okay. Treatment. Treatment is a type of treatment. Ask for clarification regarding what treatment. Okay. What treatment. So that you have to say there. Okay. To test for. Yeah. Then firecracker Double one. Okay. Yeah. To test for suspected leaking dash. Leaking dash. Bowels, blood vessels, leaking, leaking. To test for suspected leaking, veins, arteries, okay, blood vessels. Anything else you think about that one? Leaking what? Okay. So for that one, treatment options are explained. Okay. So you can say arteries, veins, blood vessels. In the eye. Okay. Yes. Next one. Uh, Firecracker 12. Yes. Firecracker 12. Expressed concern about possible need for a dash. Maybe surgery, maybe diet, dietary regimen, exercise regimen, or medication regimen, or operation, or yeah, express concern about possible need for maybe treatment, maybe medication, maybe drugs, maybe rest, home care, consultation, review, appointment, post-operative care. Zoya, post-operative is one word. Post-operative care, post-operative is one word. Yeah, recovery. Okay, very good. So now you people are ready for the audio. You people are ready for the audio. Okay, fine. Yes. Are you ready for the test now? How many of you are ready? Let me see how many regular students are there in this and how many guests are there in this. Yeah. Arman is a regular student, a new student, Grishma, then Jay Lakshmi. Grishma is bringing many of her friends. Very good. I like it. So Jayapriya, Mageshwari, Manjula, Pranita, Prasanna, Priscilla, Shamili, Jeniba, all these are regular students. Yeah, Vinita, yes. Tintu and Zoya are our guests. Tintu and Zoya are our guests today. Fine. So welcome to the platform. Attend the session. Today is a demonstration session and all the admissions are already closed, finished. If you want the admission for the next batch, you can ask me. Now all the admissions are closed presently. Okay. If anybody is interested, you can contact me personally or you can contact Meera, the coordinator. Okay. So, yeah, I think Meera is here. So Meera, you can type your number and you can type my number also, both the numbers, so that they can contact either you or me. Okay. Better they don't contact me. Right. So because I'll be always busy. So now here, let us see. Get ready for the, and whenever you want to play the audio in the same book, you have to go a little up. There you will have on the first page, there will be an icon. See here. To access the listening test audio, click the Navi icon. So this is Navi blue. Okay, Navi icon, navigation icon. So this will navigate you to the audio. Many people don't even bother about it. Sir, where is the audio? Sir, where is the audio? Sir, where is the... I don't understand. Graduates, postgraduates, nurses, doctors, so much experienced. Where is your maturity? Why don't you check there? See, there itself it is there. Just click on that one and it will take you to the audio. So here is the audio. I'm going to play it now.
Occupational English Test. Listening. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only.
Target 12 out of 12.
Complete your answers as you listen.
Write in your notebook. Write 1 to 12
At the end
in
of the
your
test,
notebook.
you'll
Write
have 2
neatly, write
minutes
separate
to
letters.
check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear an ophthalmologist talking to a patient called Dominic de Sousa. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Now, Mr. de Sousa, I've got your notes here, but I wonder if you could tell me in your own words when you first had problems with your eyes, how the condition developed, what treatment you've had, and anything else you think I should know.
Yes, of course. Well, I've got the usual age-related problems with my eyes. I started getting short-sighted about 5 years ago, soon after I retired, so I had to get glasses for that. But with this latest problem, I realized that my eyes had got much worse quite suddenly. What happened was, I was walking home at dusk one evening. It was getting dark and there wasn't much light, and I suddenly realized that I was struggling to see where I was going. And that wasn't all. I noticed I could see much better out of my right eye than I could out of my left. It was all a bit worrying.
Yes, I see.
I mean, this was quite recently. But after that, my eyesight got worse fairly rapidly. I mean, I was doing some volunteer work for a charity, but I've had to give that up. Well, for the time being, at least.
I see. And you've been to see a local optician?
Yes, I didn't know what else to do. He did some tests and then said he thought he could see what he called drusen at the back of my left eye.
Right.
So he referred me here for further investigation. But he did suggest in the meantime that I should take a preparation that's high in lutein. He also said I should up my levels of green vegetables. Well, that's sensible anyway, so I've done that.
Good.
I was quite worried after that visit, as when I looked online at what he'd said, it seemed to suggest I'd got macular degeneration. So that was really frightening.
Well, your optician was right to refer you, and from what you've described, that is a possible diagnosis. But we need to do more tests to see if that is the case or not. So what's the situation now?
Well, I can't see very well using my left eye. Something's definitely wrong there. Like, I find it hard to estimate size. You know, things look smaller with my left eye than they do with my right.
Right.
But apart from that, the area right in the middle is blurred. It's all quite unnerving.
I can imagine. And how's your general vision?
Well, let's think. The optician said that I had no problems with my peripheral vision, and there's been no change in that as far as I can tell.
Right.
And I'm still coping day to day. I mean, I can still manage things like watching TV, which I'm grateful for. But I recently decided I should give up night driving. I just felt my vision wasn't good enough anymore. Actually, I read in the leaflet you sent me that you might want to carry out an angiogram. Is that one of the tests you're thinking of?
One of them, yes.
Could you tell me a bit more about that, please?
Well, it's quite a specialist test. What it would do is allow us to see the back of your eye, and the reason for doing this is to establish whether perhaps your problems are being caused by a blood vessel there, which may be leaking. And it could be that which is affecting your vision.
I see. Oh, another thing I read about is laser surgery. Is that the treatment for that condition? Because I'd be really worried about having that.
Well, we need to do the test first, and anyway, even if that is the cause, this condition can settle by itself. If it doesn't, there are various treatments we can offer. Yes, laser surgery is a possibility, but we're not at that point yet.
I see.
So we'll do the test, but what I'd like to suggest in the meantime are a few things you can do to help your situation.
Extract 2, questions 13 to 24.
Yeah. Now, I told you there are 3 phases, right? I told you that there are 3 phases. The first phase is pre-listening, that is a brainstorming. And the second phase is while listening, that writing the answers. And third one is post-listening, checking your answers, whether they are capital letters, 1 word or 2 words, check the spelling, check the word form, check the usage, okay? Check the clarity. Come on, check, because I'm going to give you the answers now. I'm going to give you the answers. Check what? Check the spelling. Now, post-listening stage. Now you have post-listening stage, just, okay, before you start, you will have, okay, post-listening, 30 seconds, okay, till the episode goes off until this next part, extract 2, like that one, before that one. You have to check on these things. First one is check the spelling. Next, check the word forms. Then check 1 word or 2 words. 1 or 2 words. It is 1 word or it is, for example, post-operative care. Zoya wrote post-operative. Post-operative is 1 word. Okay. Sometimes given 2 words also. Right. 1 word or 2 words. Then next one, clarity. Check whether it is clear or not. Whether it is clear or not. We'll check whether it is legible. Legible means able to read or not. Okay. Then check the presentation. Okay, check the presentation, whether it appears beautifully or not, attractive or not. The spellings, word forms, 1 or 2 words, clarity, legible or not, presentation. Okay, so check this font, whether it is round or not, the size of the font, whether it is small or big. Some are big, some are small. So maintain the same font. Okay, and write whether they are individual letters, because this is very important. This is the area where everyone loses marks. Okay, everyone loses marks. Whether every letter is individual or not. You should write separate letters. Don't write cursive writings, because many people cannot understand cursive writing when you are messing up with words. C becomes I, or I becomes E becomes a C, like that one. Confusion will be there. So be very clear. Write individual letters as far as possible, so that you will not lose your marks. Is that clear? So next one, individual letters should be there. Right. So these are the points you have to focus. Now, I'm going to give you the answers. Yeah, let us check the answers now. Yeah. Yeah. Yeah, you can check your answers now. So first 6 questions, answers are here. Here are the answers for the first 6 questions. Check your answers, please. First 6 questions. First answer, light is enough. Evening is there or not, no problem. If it is there, it's okay. If it is not there also, it's okay because it is in brackets. Second one is volunteer. Is important. A charity, brackets, no need. Volunteer is there, that's fine. Others, a volunteer or charity volunteer or a charity volunteer, anything is okay. Then next, number 3, drusen. Drusen, spelling mistakes, check. Green vegetables or greens. Green vegetables or greens. Next one, macular degeneration. Macular degeneration. Check the spelling very carefully. If the spelling is not right, don't award the mark. If the spelling is right, then only award the mark. Then next one, size. Next one is size. Size. Okay, the is not compulsory. So next one, 7 to 12. Yeah. Blurred or blurry. Blurred or blurry. Double R, double R, double R. These are word forms. Blurred, blurry, different forms. No problem, these 2 forms. Any other things is wrong. Peripheral, spelling. Night driving, driving at night. Only driving is wrong. If you don't write night, then it is wrong. Angiogram, angiogram, angiogram. Then it's blood vessel. Leaking blood vessel, not vessels. Okay? Vessel, leaking. So there you have to see what is the word given there. Is there any A? To test for suspected leaking blood vessel. Blood vessels, singular or plural, both are okay here. Blood vessel or blood vessels, both, because A is not given. A is not given. Then laser surgery. Laser surgery. Yeah. Now, put your marks. How many marks you got? How will you put your mark? How will you put your mark? You have to put your mark like this. Okay. How you will put your mark? For example, out of 12, right? Out of 12, how many marks you got? You have to put there. So out of 12. Where is this? Where is this? Where is this? Okay. What is this font size? Yeah, come on, all of you write out of how many marks you got. So you can write like this. Okay, I'm writing here. Out of 12. So 1, 2. Out of 12. Okay. How many marks you got? I got 0 because I did not give even one answer right. So I got 0. Maybe you got 10 or 11 or 12, whatever you got, you give that mark. Then write here your name. Write your name. For example, Abraham Lincoln. Write your name. Abraham Lincoln. Write your first name and second name. Then write your profession. Nurse or doctor. Nurse or doctor. Whatever it is, you write there. Next, write the date. What is the date today? That is 26 June. Write June in words. 26 June. 26 June. And what is that? 26 June 2024. 2024. 26 June 2024. Okay. 26 June 2024. So next one. So you can, yeah. What's the name of this one? The name of this task is, what is that one? What's the name of this patient? Tony Fitzgerald, no. Yeah, Dominic D'Souza. Right down there, Dominic D'Souza. So Dominic D'Souza, you write down there. Okay. Dominic D'Souza. So like that you write down. And send me on WhatsApp. Send me on WhatsApp. Very good, very good, very good. The highest mark today is Shamili. Shamili, you don't attend the class only, you're getting 11 out of 12. I wonder. Huh? So that means if you don't attend, learn from Shamili, okay? Shamili, very good. Learn from Shamili. She doesn't attend the class. That's why she's getting 11 out of 12. If you attend the class, you'll get less marks maybe. Correct, no, Shamili? Hmm? Yeah, 11 out of 12. Arman Kanani has sent the answer sheet. Yes, very good. So Arman Kanani, don't write cursive writing, I told you, no? Peripheral, spelling mistake. Okay. Then night driving, okay. Then angiogram. Write separate letters, better. Surgery, your E is looking like C. Okay, volunteer. Okay, light. Then Drusen. Drusen, what happened? Drusen is correct, no? Drusen, what happened to you? Why you gave wrong mark? Is it a wrong place you have written the answer? Drusen, Drusen. Correct only. Then why did you give wrong mark? Oh, you did not write the answer. Okay, okay. Afterwards, you wrote the answer. Okay, I understand. Because it is with pencil. Now I can understand. What about the other? Send your marks, papers, please. Okay, you want my, okay, you want my, what is that? Link. You have my WhatsApp number. Clear all drawings. Okay. So let me check and I'll give you. No problem. What to do? So contact the admin. Contact the admin. Okay. Copy link. Yeah, you can send your photo here. Prasanna Ankam, A capital letter, registered nurse, N capital letter. What is this? See? How I am correcting? Prasanna Ankam, you have to write A capital letter, registered nurse, N capital letter. 26 June, Dominic D'Souza, very good. Janapriya. Janapriya, second name, you did not write a nurse. Okay. 8 by 12, very good. Geneva, 9 by 12, very good. Then peripheral, Zoya, spelling mistake. It's wrong. Okay. Yeah, Manjula Hemanti, you got 5 out of 12. Okay, maybe you are late or I don't know, you missed the points. I mean, after the explanation, you came. Okay, no problem, don't miss. Yeah. So that's really fine. That's really fine. Very good. Yeah. So now, Grishma has sent the question. Grishma, your handwriting is very nice. A little I and small letters, be careful. Your handwriting is very nice. Most probably you will not lose the marks at all. Okay. But blood, O and D are messed up. Why you separate, na? Why are you putting Fevicol? Why are you putting Fevicol? This Grishma girl has brought 2 new students to Grandmaster class. Very good. So that means that she is really learning some things. Those who are not bringing, that means they're not learning anything. What to do? Simon sir is not teaching them anything. Huh? No need to bring anybody. At least pass on the message. Sir is working hard for you. Huh? Sir is working hard for you. So Pranita has sent Pranita little letters. Okay, same size you write. Some are big, some are small, like that one. Okay, right. And next one. Okay, so are you happy with your 1 minute? 1 minute. Was the brainstorming session useful? Brainstorming session beneficial? Joseph Geneva. Yeah, I got your mark. Yeah, yes, Joseph Geneva. Yeah, your handwriting is very good, Joseph. Your handwriting is very good, but your S is sometimes big and sometimes small. Okay, your T and I you are joining, G and H you are joining. Don't write join. Okay, volunteer. L should go up. Huh? Volunteer. First E is okay. Second E is looking like O. Why? Be careful. Be careful. Okay, come on. Was the brainstorming session beneficial? How beneficial was it, you think? 0% beneficial or 50% beneficial or 100% beneficial? How much percent? Anything. 0 to 100, anything you can give. So what is the percentage of benefit you are achieved for this one? Yeah. What is the percentage of benefit you achieved here in this particular one? Okay. So we are going to do the full listening test. Full listening test. Okay. We're going to do the full listening test. So according to your time and according to your patience, I am there. Okay. This is a demo session. And so I am preparing the students for the next batch. Okay. This batch is full. This batch is full, totally full. Right. Yeah. So shall we go into the second extract, extract 2? Nobody is interested. You don't find benefit, so let us stop it. Don't want. Let's stop it. Okay then. No one thinks benefit. Only Geneva, Pranit, and Jayapriya, they find benefit. Okay. I'll call you 3 people personally and I'll give you no problem. Okay. No one feels it is useful. So we'll abort. Okay. Abort. You know what is abort? Huh? No one feels it is useful. Yeah, me too. Means Priscilla also feels it is not useful. Okay, good, good. Come on. At least respond. No, sir has explained for how much time. Huh? At least 0% you tell no benefit at all. This is a waste of time, right? Huh? Then how will I go for the next session? Extract 2. Tony Fitzgerald. Come on, give your percentage. No? Otherwise, I will not take second part. Okay, part B I will not take. I'll stop after part A. Because these 4 people, Priscilla, Arman, Grishma, and who is that? Pranita, Jayapriya, and Geneva. They have told me. So that's why I'm taking the second extract. And if nobody gives, I'll not take the part B. I'm sorry. Yeah, part B. Yeah, shall we move on? Yes or no? Yes. Can we see Joseph's and Grishma's handwriting? Very good. I'm going to show you. It's a Geneva. Her name is Geneva. Okay. Yeah, I will show you. I'll show you. Definitely, I'll show you now. Say somebody is asking your handwriting. See, now you people are becoming famous. Huh? They want to model on your handwriting. Good. Yeah. Come on, say yes or no. Shall we continue or shall we stop? Shall I stay or shall I leave? I have planned actually many sessions today. And now in the morning itself you are like this. Then till night, what I will do? Better I'll call individually and I'll do something. Yesterday was speaking day, and many people did not do speaking sessions. Okay. Yeah. So I am going to show the handwriting of those students. Okay. What is this and what is this? Yeah. So share the screen. Yeah. Handwriting should be like what? role modeling on somebody's handwriting. Very good. See, I took the name of somebody and the handwriting is very excellent, right? So sir has told that this handwriting is very good. And people started asking, Joseph Cheniba. Yeah. Let me show you the handwritings of those students who submitted. Yeah. So this is, there is, I think it's loading, right? Just now I added here, no, WhatsApp. And the other one, it is there. It take 2 seconds time. Loading. Yeah. So let us see the second one. Tony Fitzgerald. Tony Fitzgerald. Tony Fitzgerald. Only the first name should be capitals. Okay. Yeah. So, yeah, starting from here. Adira, Karuna. Yeah. So Grishma. Yeah, this Grishma's handwriting. You want to see, you told, no? Some here and there there's a missing. See I here. I is small. Why I is small? Your A and O looks same. So this O is messed up with a D. Its O is messed up with a D. Yeah. Laser surgery is like loser surgery. How can you give right mark for this one? Grishma D'Souza, Grishma Shankara. How can you give mark for this one? Laser surgery is like loser surgery. Huh? Loser, Loser, like that it is. How can you give mark for that one? You lose this mark. You lose this mark. Definitely you lose this. Blood. Why this O and O, D are joined together? Why can't you separate that one? R. Where is R? Huh? Where is R? It's not clear. I. Not clear. Okay. I should be same sides. Okay. So here is I. Okay. Macular degeneration. This R. What is this R? And what is this R? Make one standard R. Na? Make one standard R. Don't use 2, 3 different types of R. Green vegetables. What is this? EEN. Why? Huh? Why EEN together like vegetable? Where is EG? Why EG is joined like this? Be careful. Okay. That's handwriting is good, but clarity is not there. That's what I mean to say. Okay. And Manjula Hemanti. Manjula Hemanti. Yeah. Yeah. This handwriting is good, but the thing is, quality is not very excellent. Yeah. Don't use pen. Write pencil actually, and write cursive writing. Don't write. Because if you don't understand, no, you lose. Many people lose the mark here. That's why. Okay. Then Manjula Hemanti. Okay. Where is the paper, Manjula? Pranita. Pranita. Yeah. Right. Be careful. See this one, B and L. Green vegetables. You put a tick mark. What is this? B and L? I think L and D. I think L and D or LOL. Why should I think it is B and L? I can think it as L and O and L or L and D. Anything I can think. Why this E is up and this E is down? Macular, U and L joined, A and R joined. Why? Others are separate and these are together. Why? MSC together. Size. What is this S? Is this S? Is this looking like S? Is this looking like Z? Is this looking like Z? Middle. What is this? This much as like a snake. It has come up the front side. Why? You want to bite me or what? Here. Peripheral. Where is E? Why the size of E is dwarf and this E is big? Why? What is the difference between this and this? Why? Night. Is this G or S or 8. What is this exactly? So be very careful. What is this? What is this spelling? Be very careful, please. Joseph Geneva. Yeah, this is Geneva. The handwriting is very good, very neat, but still, okay. Careful. Volunteer. This E is okay, but this E looks like O. Second E looks like O. Okay. Green. First E is, every time first E is good for you. Second E is looking like O. Geneva. I think you can understand what I'm telling. Okay. Be very careful. E should be like E, not like O. Macular generation. Macular generation or macular degeneration. I don't know now. I have to check. Macular degeneration. That's why you gave wrong mark. Okay. Macular degeneration. You said macular, like that you wrote. This ED is a DE actually. Macular degeneration. Macular generation you are thinking. So you have to see very carefully. You lost the mark. You got the answer, but you lost the mark. Okay. Blurred. L and U together looks like W for me. Careful. Peripheral. R and I. Why you joined? Night driving. Angiogram. Don't tick on the answer. Now tick. Put a tick by the side. Na? Why so much? You can put a tick to one side. Okay. You can put a small tick to one side. Like this. Little. Okay. Little light this side. Not on the word. Na? It doesn't look very neat, right? Then next step should be like this. Like that. Enough. Okay. Right. That's fine. Good handwriting. Then next. Grishma, Pranita, Joseph, Manjula Hemanti. Manjula Hemanti, she has sent a PDF. Yeah. Yeah. Light, volunteer. Light is correct, and volunteer. Okay. Why do spelling mistake? Green. This E is looking like C. This E is okay. This is again looking like C. Size. Z is looking like 2. No problem. What? No problem. Night. What is this? Is it looking like N? Is this looking like H? Hemanti. Should I teach you ABCD? No problem. I'll teach you. No worries. Laser surgery. What is this? How can I give you mark for this one? Then next step. Did I close the window? Yeah, that's enough. So, ready for the second task. You said you are ready for the second task. Okay, Tony Fitzgerald. Yeah. Tony Fitzgerald, yes. Now it is 2 o'clock. I think it is lunch time. So we'll continue after lunch. What do you say, all of you? Shall we continue 10 minutes and finish off and go for lunch, or your wish? Your wish. Come on. Lunch or class? Lunch. Lunch or class? Come on, anyone? Anyone first? L or C? L or C? Come on, first. First. Class means we'll go for class. Lunch means we'll go for lunch. Anyhow, it's only 10 minutes matter. So already we are ready. 10 minutes plus 10 minutes. Yeah, then finish it in very fast. 10 minutes. Okay, many people said class. Yeah, I love that spirit. Yes, come on. Come on. Get ready. Tony Fitzgerald. Yes. Keval, write down number 1. Question number 1. Q, not number 1. Q13. Keval is there? Keval is there? Yeah, Keval will be there. Okay. Yeah. Keval, right. Q1. Q13, sorry. Q13, yes. Tony Fitzgerald, yeah. Tony Fitzgerald is a boy talking to father. The other one maybe a lady. So maybe. Yeah, come on. Q13. Write down. Write down in Q13. What do you think? Come on, brainstorm. 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 Q13, brainstorm. Described by pediatrician as dash. Seizures started 6 weeks ago. Seizures started 6 weeks ago. Described by pediatrician as. What type of seizures or some type or something? Yeah. Epilepsy. Okay. So seizure started 6 weeks ago. Tony Fitzgerald. Yeah, having seizures. Yeah. Febrile. Priscilla. F should be small letter. Write down its small letter. Fast, fast, fast. Okay. Fits. Febrile. Epilepsy. Come on. Come on, come on, come on, come on. Yes. Come on. Don't be lazy. Yeah. Q14. Q14. Seizures. Q14. Yeah. Q14. Begin with a dash on face. Begin with a dash on face. Okay. Q14. Begin with a dash on face. Twitching, weakness, folds. Then, what is this shot? Begins with a shot on face. Come on, come on, come on. Write down whatever you want to write. Write down. No problem. If it is wrong, also no problem. It is right, also no problem. Wrong, also. But write something. Even it is nonsense, also write. Writing is very important. Participation is very important. Remember that. Itching, weakness, twitching, short, weakness, twitching. Come on. Folds, curves, maybe bend, pull, scratches, or whatever you want to think, just to think. No problem. Yeah. Q15. Q15. His mouth makes a dash movements. His mouth makes a dash movements. His mouth makes a dash movements. Ing form will come. Twisting, jerking, irregular, involuntary. Okay. Come on, come on, come on. Yes, yes, yes. So I'm going to increase the number of sessions because new students have come. Yeah. Involuntary, irregular, twisting, jerking, not jerky, jerking. Better. Involuntary, twisting. Okay. Right. Next, Q16. Q16. Reports feeling dash during seizure. 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 Question number 16, Q16. Unconscious. Reports feeling unconscious. Feeling when she becomes unconscious, how can she feel? Feeling weak, feeling tired, feeling worried, feeling tensed, feeling upset. All feelings should come here. Okay. Feeling confused, feeling tired, feeling pain, feeling difficulty, feeling worried, feeling upset, feeling tensed. Okay. So next one, Q17. Q17, Keval. Q17. Often suffers from dash, post seizure. Often suffers from dash. Often suffers from dash. Often suffers from dash. Come on, come on, come on. Speed up. Often suffers from fatigue. Yeah. Loss of consciousness, fatigue. Yeah, come on, come on. Tiredness, maybe. Weakness, yeah. Tired. Suffers from tired, no. Suffers from tiredness. Involuntary movements. From involuntary movements, due to involuntary movements, but not from. Okay. Yeah. Next, question number 18. Performing well academically is dash like maternal grandfather. He is dash like maternal grandfather. He is diabetic maybe. He is tall maybe. He is short maybe. He is fat maybe. Okay. So like maternal grandfather. Family history maybe related to that one. Is dash like maternal grandfather. Maybe diabetic. Maybe asthmatic. Maybe something else. Thinker. Academically, is performing well. Is forgetful maybe like maternal grandfather. Some medical condition, yeah. Is intelligent like maternal, very good. Is intelligent, is clever. Okay. Is similar. Like is already there. Like means similar only, na? Jayapriya. Like means similar. Like is already there. Similar to maternal father, what? Similar. Like means similar. Okay. So, yeah. Question number 19. Recently diagnosed as, yeah, anemic. Very good. Recently diagnosed as diabetic, anemic, asthmatic, hypertensive. Yeah, question number 20. Question number 20, Q20. Q20. Question number 20. Received dash straight afterwards. Born 42 weeks. Birth. Born 42 weeks by emergency C-section. Received a dash straight afterwards. After birth, what did he receive? Or what did he receive? Or what? Medical history. Received what? Straight afterwards. Maybe blood transfusion. Blood. Okay. Or what else? Had mild dash. Mild dash. At the time of birth. Had mild dash. Maybe, okay. At 13 months, had a viral infection. 22. Dyspnea, fever, jaundice, oxygenation, grunting, blood. Okay, fine. So question number 22. Yeah. Experienced a one-off dash. Experienced a one-off dash. Something. At 13 months, experienced a one-off dash. Guess. If you can guess anything. 23. Mother is of dash heritage. Mother is of dash heritage. Family history. Mother is of dash heritage. 24. Mother suffered from dash, some medical condition. Mother suffers from some medical condition. Just to give one or two names, no problem. Yeah. Yes. Tony Fitzgerald.
Occupational English Test 4. You hear a neurologist talking to the father of a 9-year-old boy called Tony, who's recently started having seizures. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, Mr. Fitzgerald, I understand that Tony's 9 and his seizures started about 6 weeks ago?
Yeah, that's right. The paediatrician was worried because Tony was experiencing what he called episodes of confusion. That's why he recommended this neurological evaluation.
I see. So what happens when Tony has a seizure?
I suppose the first thing we notice is that he gets this kind of vacant look. We didn't understand what was happening at first, why it was that he didn't seem to answer our questions, but he's since told us that he can't. It's like he loses the power of speech altogether. I had a chat with his teachers to see if they'd spotted anything unusual, and they said they'd sometimes noticed the same kind of behaviour at school too. Later, we noticed that his mouth moves. It's as if he was chewing something, but there's nothing there. I suppose all that goes on for about a minute or two.
So, Mr. Fitzgerald, I understand that Tony's 9 and his seizures started about 6 weeks ago?
Yeah, that's right. The paediatrician was worried because Tony was experiencing what he called episodes of confusion. That's why he recommended this neurological evaluation.
I see. So what happens when Tony has a seizure?
I suppose the first thing we notice is that he gets this kind of vacant look. We didn't understand what was happening at first, why it was that he didn't seem to answer our questions, but he's since told us that he can't. It's like he loses the power of speech altogether. I had a chat with his teachers to see if they'd spotted anything unusual, and they said they'd sometimes noticed the same kind of behaviour at school too. Later, we noticed that his mouth moves. It's as if he was chewing something, but there's nothing there. I suppose all that goes on for about a minute or two, and then it takes about 5 minutes or so before he's back to his normal self.
And how is Tony after a seizure?
Well, one thing that struck me was that he hardly remembers anything about it at all. I found that very disconcerting at first. He's told us that he becomes frightened whilst the attacks are happening and that he feels exhausted after. In fact, he often needs to lie down for a bit, and he might even nod off. He also complains about having really bad headaches, though that doesn't happen every time.
And how would you describe Tony's ability to cope with life in general, like at school, for example?
Well, Tony hasn't got any problems at school. He meets the expectations of his teachers, even if he doesn't exceed them. You know, just your average boy, until now, that is. But he is creative, especially with his writing. In fact, one thing that's slightly unusual about Tony is that he's ambidextrous. It runs in the family on my wife's side. Her father was too. His teachers say he often writes with both hands in the same session. I did have a word with his teachers a while back because I was concerned about his spelling. They sent him for tests, and we just had confirmation that he's mildly dyslexic. It's a relief, actually, because now he's getting the support he needs.
Yes, I see. And going back to when he was born, has Tony had any health problems at all?
He arrived late, well past his due date, at over 2 weeks late, and the labour didn't go as planned. My wife was induced, and Tony seemed to react badly to the stuff she was receiving intravenously to bring on labour. In the end, he was born by caesarean because he was in distress. Then he had an infection and needed a course of antibiotics. They began that immediately, and he was on them for 5 days. They both had to stay in hospital because of it. But other than that, he breastfed well and was a happy baby, even if he did have a touch of jaundice. That soon disappeared without any need for further intervention.
I see. And there's been nothing of note since then?
Well, there is one thing. About a month after his first birthday, Tony came down with a bad virus. He had a high temperature of about 40 degrees. That brought on a febrile seizure. It was so scary. But it only lasted about 5 minutes, and then he seemed to be back to his normal self. That's the only one he's had.
Right. Is there anything in his family history I should be aware of?
Nothing of note, no. My wife's parents are Chinese, so Tony's learned both languages from when he was a baby. I don't know if that has a bearing on anything. His grandparents are all fit and well. In fact, relatives on both sides of the family seem to die of old age. Though maybe I should mention that my wife does get sciatica from time to time. She hasn't had it for ages, but when she does, she can be out of action for weeks.
Okay. Well, thank you for filling me in on all of...
You have time now to check.
That is the end of Part A. Now look at Part B. Part B.
Okay. Now let us check the answers. Yes. These are the answers here. 13 to 24. Episodes of confusion. Questions you are not able to see. One second. Hello? Let me check once again. So 12, 14, 24. 24, 14, 24. Hello? I can't see the questions. What's wrong? So reduce 14, 26, 14, 20, 19. So 219, 2.6. Okay, fine. Maybe something. Now can you see the questions? Can you see the questions now? Can you see the questions now? Okay. Yeah. So no problem. I'll just give you again. Yeah. So that's fine. Okay, it was an initial issue. Afterwards, could you do? Yeah, of course. I think I played again and I showed her.
So, Mr. Fitzgerald, I understand that Tony's 9 and his seizures started about 6 weeks ago?
Yeah, that's right. The paediatrician was worried because Tony was experiencing what he called episodes of confusion. That's why he recommended this neurological evaluation.
I see. So what happens when Tony has a seizure?
I suppose the first thing we notice is that he gets this kind of vacant look. We didn't understand what was happening at first, why it was that he didn't seem to answer our questions, but he's since told us that he can't. It's like he loses the power of speech altogether. I had a chat with his teachers to see if they'd spotted anything unusual, and they said they'd sometimes noticed the same kind of behaviour at school too. Later, we noticed that his mouth moves. It's as if he was chewing something, but there's nothing there. I suppose all that goes on for about a minute or two, and then it takes about 5 minutes or so before he's back to his normal self.
And how is Tony after a seizure?
Well, one thing that struck me was that he hardly remembers anything about it at all. I found that very disconcerting at first. He's told us that he becomes frightened whilst the attacks are happening and that he feels exhausted after. In fact, he often needs to lie down for a bit, and he might even nod off. He also complains about having really bad headaches, though that doesn't happen every time.
And how would you describe Tony's ability to cope with life in general, like at school, for example?
Well, Tony hasn't got any problems at school. He meets the expectations of his teachers, even if he doesn't exceed them. You know, just your average boy, until now, that is. But he is creative, especially with his writing. In fact, one thing that's slightly unusual about Tony is that he's ambidextrous. It runs in the family on my wife's side. Her father was too. His teachers say he often writes with both hands in the same session. I did have a word with his teachers a while back because I was concerned about his spelling. They sent him for tests, and we just had confirmation that he's mildly dyslexic. It's a relief, actually, because now he's getting the support he needs.
Yes, I see. And going back to when he was born, has Tony had any health problems at all?
He arrived late, well past his due date, at over 2 weeks late, and the labour didn't go as planned. My wife was induced, and Tony seemed to react badly to the stuff she was receiving intravenously to bring on labour. In the end, he was born by caesarean because he was in distress. Then he had an infection and needed a course of antibiotics. They began that immediately, and he was on them for 5 days. They both had to stay in hospital because of it. But other than that, he breastfed well and was a happy baby, even if he did have a touch of jaundice. That soon disappeared without any need for further intervention.
I see. And there's been nothing of note since then?
Well, there is one thing. About a month after his first birthday, Tony came down with a bad virus. He had a high temperature of about 40 degrees. That brought on a febrile seizure. It was so scary. But it only lasted about 5 minutes, and then he seemed to be back to his normal self. That's the only one he's had.
Right. Is there anything in his family history I should be aware of?
Nothing of note, no. My wife's parents are Chinese, so Tony's learned both languages from when he was a baby. I don't know if that has a bearing on anything. His grandparents are all fit and well. In fact, relatives on both sides of the family seem to die of old age. Though maybe I should mention that my wife does get sciatica from time to time. She hasn't had it for ages, but when she does, she can be out of action for weeks.
Okay. Well, thank you for filling me in on all of...
Okay.
That is the end.
So, there was some confusion, I think. Yeah. So, I'm sorry for the confusion. Right now, check your answers. Yes. Check your answers and correct your answers and send me the question answer paper. The things which are there already in brackets, no need. No, I could not stop because some people are there on the YouTube also. We already started. Yes. So check your answers and update your scores. Update scores, please. Okay. Update scores, please. What is this? Yeah. Update scores, please. Then we'll have lunch. Then afterwards we'll have part B and then part C. Then afterwards reading. Okay. I'll message you. Yeah. Then first out of 12, second part. So second part out of 12, how many? Then out of 24, how many? First you write out of 12. Then you say out of 24, how many? Add the A and B, both. Extract A and extract B. Total and tell me. Ashwini got 7, Farzana got 9, Arman got 6. Come on. So Arman got 13 out of 24. Good. You'll improve slowly, don't worry. Yeah, others also. Jeniba got 10 by 12. And out of 24, how many Jeniba? Yeah. Come on, submit. Yeah, Pranita got 12 by 24. Good. 50%, that's fine. Jeniba 19 out of 24. Very good. So yesterday we have focused on speaking. Today we'll focus on listening and reading. Good handwriting, Jeniba. Even better than before. Jayapriya, 16 by 24. Good. Good. Yeah. Then give your feedback, all of you. How did you like this session? Give your feedback, please. Give your feedback, please. Yeah, now I'll talk to the new students. Okay. I'll talk to the new students. Yeah, all of you can give your feedback, please. Don't open your videos, anybody. Just talk on your audio itself. Yeah. First, let us see. Arman. Hello, Arman.
Hello, sir.
Yeah, how was the session? Was this beneficial for you?
Yes, sir. In the first extract, आपने जो मतलब क्या बोलते हो एंटिसिपेट वाला कराया था वो बहुत अच्छा लगा था मतलब पहले से हम कर रहे थे एक्सट्रैक्ट 2 में वो बहुत कम था तो उसमें अच्छा नहीं था
Okay, no problem. So every time we will not go too much. You can practice more and more like that. Okay. So that's nice. That's nice. Next one is, next one, Jayapriya Kadiresan. Jayapriya, new students. These are new students. Welcome to the classes. Yeah, Jayapriya, you can speak.
Yes, sir, it was very useful, that brainstorming method. And really, this is my first class. I felt the benefit because of this class.
Okay, fine. You attend the sessions as many as possible. Whenever I'm giving the link, you can attend. Okay. Then next one.
Sure.
Jeniba. Geneva.
Yes, sir.
Yeah, Geneva, share your experience, please.
So the brainstorming was really very useful because I was able to find just the answer by using that method. So thank you so much.
Okay,
And
so
I have
this is
very
the first
short memory.
first day you are attending
Yeah.
these sessions. Was there any difference in your learning style?
Yeah, I mentioned about brainstorming. That was really informative because I hardly guessed the answers. I just to go through questions whenever I do listening. So now I got an idea how to do the listening. Like you have mentioned about pre listening, while listening, post listening. Those are new things for me. So it is really helpful.
Yeah, that's really very fine. Thank you. Simon sir is hungry. He's going for lunch. Bye bye. See you later. Yes.